Hello, my name is Batrisyia Khairina. My metric number is 97784. So for today, I would like to present about how to instill eye drops. So for today, I have 4 agendas. The first one is the learning outcomes. The second one is the scenario. The third one is the health education video, and the last one is the conclusion. So for today's video, I have stated 6 learning outcomes. The first one is to state the purpose of the prescribed eye drops and the importance of using them as directed. The second one is to describe ways to prevent contaminations during eye drop use. The third one is explain proper storage of eye drops at home. Fourth, describe how to use multiple eye medications correctly. The fifth one, recognize common side effects and when to seek help. And the last one is demonstrate the correct way to instill eye drop. Okay, so let me explain first about the patient's biodata and the scenario. So Madam Khairina is 28 years old and she was recently discharged from the hospital after sustaining a minor eye injury while gardening. So a small piece of soil entered her right eye, causing irritation and a superficial laceration. So she was prescribed with antibiotic eye drops to prevent infections and promote healing. So the doctor referred her for a follow-up home health visit because she expressed a difficulty and uncertainty about using the eye drops in her own. So the next day, Nurse Raja, which is me, a community health nurse, arrives at Madam Khairina's home for a scheduled visit. So the purpose of the visit is to teach Madam Khairina on how to properly instill her prescribed eye drops, reinforce hygiene practice to avoid contaminations, and ensure proper storage and handling of the medications. So there are 2 rollers that we've been using in this video. So the first one is the eye drop and the second one is the pamphlet. Okay, so without further ado, please watch the video.
Morning, Madam Khairina. So my name is Batrisyia Khairina. I'm a nurse in charge for you for today. So how are you?
I'm good, thank you.
Okay, so today I would like to teach you about how to instill eye drop. So is it okay? Okay, so first of all, I would like to ask, do you know how to instill eye drop actually?
As far as I know, I always just drop it in my eyes.
Okay, thank you for answering. Okay, so first of all, I would like to ask again, do you know about the purpose and importance of your eye drops?
I'm not really sure about that.
So the purpose of the medication is basically to treat bacterial infection and also reduce swelling. Also, it is important for you to use the medication based on the timing so that the medications can work effectively. So do you understand? The next question is, how do you prevent contaminations of your eye drops?
I never thought of it.
Okay, thank you for answering. So basically, there are some ways of how to prevent the contaminations. So the first one is you have to wash your hands with soap and water. It is because your hands have germs, and if you didn't wash your hands, then it can cause infections to your eyes. Next is when you open it, make sure that you didn't touch the tip of the bottle, and also you didn't put the cap on top of any surface as it can cause contaminations. So if you want to open it, just open using this one and then like this and put it like this. Okay, and then once you've done using the medication, make sure that you tie it securely. Tie it. Okay, so do you understand? The third question for today: where do you usually store your medications? Is it like beside your bed or in the fridge or anywhere?
Usually, put it in the fridge.
In the fridge. Okay, so for some medications, you don't have to put it in the refrigerator, but if the medication is needed, then you have to put it. But it is correct for certain medications. But other than that, if it is not necessary, then you just have to put it somewhere that you can reach, but it is not exposed to any sunlight or heat. Is for future knowledge. So since you are being prescribed with just one medication, so you can just use it once and done, right? But what if you are being prescribed with two types of eye drops? So basically, if you are being prescribed with two kinds of eye drop, you have to use the first eye drop first, and then wait for 5 to 10 minutes, and then use the second one. But if you're being prescribed with an eye ointment, then you have to use the eye drop first after the ointment. So do you understand? Okay. Next is about the side effects. So what do you think is the common side effects for eye drops medications?
I don't know.
So okay, thank you for answering. Basically, the common one is you will feel a bit stinging or a bit dry on your eyes, or sometimes there will be a temporary eyes blur. So if you encounter that kind of situation, please don't panic and just wait for a bit. But if your eyes are red, or you feel it's swollen, or there's a discharge, please seek help immediately. So do you understand? Now I'll be demonstrating to you on how to use the eye drop. Okay, so there are 3 ways of positioning. So it's either you standing up, laying down, or sitting. So you can choose any positions that you are comfortable with. Okay, so now the first one is you have to tilt your head to back, and then pull your lower eyelid. Okay, after that, look upward, and then squeeze the medications at the conjunctival sac. The conjunctival sac is the red area between your eyes and the inside of the lower eyelid. And after that, close your eyes slowly, and then wipe any excess of the medications. So do you understand? So now I want you to demonstrate to me on how to use the eye drop.
So first of all, I make sure my hand wash,
Okay.
and then make sure I open it the correct way. Open the cap, and then tilt my head a bit, then pull down my lower eyelid, and look upward, and drop it in between of my lower eyelid and my conjunctival in between of it. Then close my eyes slowly and wipe any excess medication.
Okay, thank you for demonstrating. So I think that is all for my teaching for today. So do you have any questions?
For the time being, I don't have any question.
Okay, so I have prepared a pamphlet for you, so as a guidance, so you can look at it, and if you have any more questions, you can just call or message me. I will gladly reply you as soon as possible. Okay, thank you.
So in conclusion, the home visit to Madam Khairina successfully achieved its objective of educating her on the correct technique for instilling eye drops. Through clear explanations, demonstrations, and hands-on practice, Madam Khairina gained the knowledge and confidence needed to manage her eye care independently. I have also reinforced the importance of hygiene, proper storage, and medication adherence. This patient-centered approach not only promotes faster recovery, but also reduces the risk of complications such as infections or improper drug use. Overall, the visit strengthened patient self-care and enhanced the continuity of care after hospital discharge. I think that is all for my health education's video and presentations for today. Thank you for watching and thank you for listening.